cranial resectioning and surgery and vision. How do I help my child? You're totally correct that you're seeing an underdeveloped maturity of vision in the left eye. Guys, this is why you're doing the work. I know people are like, I don't know what I'm doing. Yeah, you do. Because guess what? Your vocabulary is increasing. You're learning how to see things in your child, that you can have these conversations with, so you can take it to the next level. If you didn't notice this, you wouldn't be having the conversation with me right now. And that is great. So just keep up the good work. I know sometimes you're sitting there going, I don't know what I'm doing. It doesn't matter. It's working. It's just working. Because what I teach you, that's why you're here. It's working. So you have two things going on. You have the chromosome deletion, but you also have the cranial resectioning. Cranial resectioning is a serious surgery because it puts lack of movement into the skull. That's what we call scar tissue healing, whatever you want to call it, right? But you do have, to me, it almost looks like the left eye, which it's not, I know it is more like lens microphthalmia, which is just an underdeveloped eye. So I'm going to say this. So when you look at him, right? And again, I'm trying to morph my face. I'm being as respectful. I don't mean to act like I'm whatever, but I want you to appreciate it. And I have found that you can, when you see it in others, you're like, oh, that's what I've been trying to say. But when it's right in your face, it's your child, you're just like, I'm not sure. So, but I'm better at moving my right eye. So we're off here. So if you look at anybody's proportions, it's 5 eyes. 1, 2, 3, 4, 5, right? There's 5 eyes across, right? And so his left eye, and I try to get the video of it or the shot of it, you can almost see a shadowing where the orbit wants to torque in a little bit, right? And this is what's hard, and that's why I like the video, so I can catch these kind of movements, right? So, but when the eye is a little bit smaller or the muscles engaged, and it's more familiar with ptosis where you have the droopy eye, but if everybody right now just drooped their eye, put their eyes at half mast. Now keep one eye the same. Like I better with my right eye than my. Now try and open the other eye. And when they say open your eye more, you just physically can't. When the down happens, I don't care if it's in movement, the eyes or whatever, the down wants to take preference, right? Or precedence. That's why we don't, as seniors, want to fall down, right? Because we can't get back up again. The down wants to take precedence, right? You don't want the body to go from a living organism to a mass. Right? But when you have the cranial synatosis, the cranial, all that sort of stuff, because of the scar tissue, you now have, scar tissue is now mass, right? It's not living tissue anymore. And people might go, that lady's crazy. It's only a little bit. A little bit to your child is like a mountain, right? There's no little bit to babies. To you and I, we can overcompensate once we know the skill. But if we don't know the skill, there's no overcompensation. All right. So, but it's the same thing as with your child, but your child's like 100%. I don't know the skill because they're just developing. And that's why I'm all about, you need to conquer every milestone because there's more skills. The more skills you have, the more you can do later on. Right. I want your child to say, I can't do it because I don't want to do it versus I can't do it because I can't do it or I don't know to do it. And this whole thing about patterning and mimicking, no, they don't know what the movement is, especially with vision. So you need to keep an eye on that orbit. That orbit was going to make it harder for a couple of things. So if I have one eye that's doing it, the other, the biggest thing that's hard to do, first of all, I can't see you. So that's why we really got to keep an eye on. I don't like his vision report because it just shows acuity, but right now it's saying no astigmatism, but there's no eye axis. But if the eye orbit is off, there's got to be an axis issue. An axis should be 90 degrees, right? And sometimes they can go from 10 to 180, almost like they're windswept. And that's what you need to look at and work with your child. So to get, when you have one eye, and you can just do it like this. Even if I do this, I no longer can see you. Just doing this, I can't see you. Now, both eyes are fine. I didn't change my acuity, right? But I changed the structure of the binocular vision and they don't work together. I cannot see. I can sort of see the ring. I know I'm in a room. I know there's outside here. I can't see. Just doing that. And that's what people don't understand about vision. So we need to do a patching program, but I would like a better acuity report. And you really should keep up on this stuff about every 6 months, because the skull is shifting. And as the skull shifts more, right, if that eye is coming in, right, again, the left eye, but I'm doing my right, and you're doing that and you're feeling that narrowness in the face, it's just going to be harder for him to see. So you're going to have to take measures of letting him explore the object where he feels comfortable at it, and then he can take it to more advanced levels, right? You should be working with your local vision program and have him assessed for functional vision. Despite that, I would just, right now saying we're making sure it's not lens micophthalmia, because again, some programs need the diagnosis, but we can't wait for the diagnosis. But I would definitely start with a light patching program, because it's physically impossible. If you're doing this across the visual midline, if I do this, you know what I mean? I maybe can do it with my left eye right now, but my right eye, it's gone. And that's where you're seeing again the weakness. The eyes straight ahead, man, I can see you, Mom. Right? And I know your voice. So you got the auditory support and you got the visual support. But you start moving stuff around, and again, I got to move my whole head, because I can't just do a midline shift or a midline shift. And that's where you're seeing the complications with the vision. So I hope it gives you a better understanding with all of that. But I definitely would I would like to go into a light patching program, but I'd like to know a bit more about the eyes, and just either call them up and make sure there definitely wasn't an astigmatism or an axis issue, which again I doubt, or that the child needs to be re-examined with the full retinoscopy with all the markers down, so you know how to put in your what you're calling is your therapy, your interactions, your exercises. And that's what's really important. But that's where he's getting more of that wandering around. But if I can't go from like this to like looking down the hallway and back again, this is where the walking gets impaired. But they're just going to blame it on the deletion and the cranial and all this sort of stuff. Like every day I'd get with Graham, they're like, well, he can't because he's like, and that's why he can't. And I'm like, duh, but what can he do today that's better? And that's what you're seeing. That's where the hope comes from what you're doing at home. You're starting to see stuff happen. You're like, I don't know what I'm doing, but it's working. Just stay with that. Just stay with it. You don't have to be a practitioner. You don't have to know why it works. Just stick with it. But really, we need to kick in the vision, and I hope that helps. Thanks.